Hi, I'm so delighted to meet you in the program of 5 clinical pearls. Don't treat hypertension in an aortic regurgitation patient with beta blockers because beta blockers can reduce the heart rate by which it can worsen aortic regurgitation. 2. Don't give nitrofurantoin for a patient with pyelonephritis even though organisms are sensitive to nitrofurantoin because nitrofurantoin is poorly concentrated in renal tissues. Nitrofurantoin is considered as a bladder antibiotic. So it is mainly concentrated in the bladder. So it should be given for a case of acute uncomplicated cystitis rather than for pyelonephritis. And 3. What are the common drugs which can cause hyperkalemia in our day-to-day clinical practice? A for ACE inhibitor and ARB and aliskiren. Then apart from that, routine heparin can precipitate hyperkalemia. Then beta blockers, then NSAIDs, some antibiotic like trimethoprim and sulfamethoxazole, everything can. Then antibiotics like cotrimoxazole can produce hyperkalemia. Number 4, the common causes of elevation of SDOT, SGPT more than 1000 include viral hepatitis, and second one drug-induced, especially paracetamol, and third one ischemic hepatitis. When someone has hypotension for a couple of hours can produce necrosis of the liver by which it may release enormous amount of liver enzymes. Number 5, when someone is found to have fatty liver with the help of ultrasound, the most important bedside calculative test would be FIB4. So FIB4 is a bedside calculative test after all which requires only 4 parameters. One, age, and second one SDOT, and third one SGPT, and fourth one platelet count. What you have to remember that when you have fatty liver with decreased platelet count, it may signify that you are in the advanced stage of fibrosis. So FIB4 score really helps in staging the fibrosis when someone has fatty liver. So when someone presents with fatty liver, calculate FIB4 score with the 4 parameters. So it is nothing but age into SDOT divided by platelet count into root square value of SGPT. So if someone has less than 1.3 of FIB4 score, that means that patient has low risk of fibrosis. But if it is 1.3 to 2.7, then it indicates some intermediate risk. More than 2.7, then there's likelihood of more advanced fibrosis. Once FIB score clearly reveals that there is intermediate or advanced fibrosis, patient should be subjected to something called fibroscan or otherwise called VCTE, vibration control transient elastography. Thank you.